What does informed consent for Trileptal or oxcarbazepine look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And I'm going through a series where each day I talk about one of our psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're going to be talking about Trileptal or oxcarbazepine. So this is not actually FDA approved for any psychiatric indication. It is a seizure medication approved for partial seizures, but we often see it used off-label for bipolar disorder, primarily mood stabilization and treatment of depression, as well as neuropathic pain. I think of this medication as more of a third-line option for bipolar disorder and typically not as effective for people who have bipolar 1 disorder or really severe depressive and or manic episodes, especially if there are psychotic features. However, sometimes it's the only medication people can tolerate because I do find that it is more tolerable than things like lithium or valproic acid or even a lot of the atypical antipsychotics. And for some people, especially with bipolar 2 or more just like a mood lability element, I do think this can be a helpful medication. So like I said, it's generally better tolerated than a lot of our other psychiatric medications, but certainly there can be side effects. So this can look like blurred vision, stomach upset, dizziness, headache, drowsiness, and fatigue. We also counsel patients about their risk of liver injury, dangerous rashes like Stevens-Johnson syndrome, hyponatremia, and increased bleeding risk. One of the things that we do have to be careful with as far as Trileptal is that it does have a lot of interactions with other medications. So it's important to talk with your prescriber about all of the medications that you're on to make sure that it's safe for you. One very common one that we always counsel patients about is that it interacts with oral birth control. And so if you're taking oral birth control, it may not be effective while you're on this medication. And so if you're not trying to get pregnant, it's probably a good idea to talk about alternative forms of birth control. If there's any other psychiatric medications that you're interested in hearing the informed consent process for, then please put it in the comments below. And lastly, I'm also putting together an email list for those of you who are interested in my content because they may have future offerings, things like resources or courses, and I want to be able to communicate directly with you all about those. So if that's you, then send me a DM with your email. I promise I won't spam you. Wishing you all good mental health, and I'll see you in the next one.